Welcome Raaonline. Chronic rhinosinusitis, as you know, it's a very important topic for the undergraduate education. As the name indicates, chronic means a long-standing infection of the nose and paranasal sinuses. Today, we'll talk about the definition of a chronic rhinosinusitis, what are the probable etiological factors for a sinus infection, and how do the clinically present with a chronic rhinosinusitis, and what is the basic pathology behind a sinusitis. And then we will discuss how do you diagnose or treat and what are the probable complications of a chronic sinusitis. So, as a definition, chronic rhinosinusitis is nothing but an inflammation of the nose and paranasal sinuses. As you know, paranasal sinuses indicate the sinuses involved, that it could be a maxillary, it could be a frontal, it could be an ethmoidal, or it could be a sphenoidal sinusitis. And now you have three types of sinusitis, that is your acute, subacute and chronic rhinosinusitis. So, what do you mean by an acute? Acute, as the name indicates, if the symptoms are lasting less than 4 weeks duration. Obviously, when you have a prolonged nasal discharge, that means you have a continuous nasal discharge, nasal block, you will have a severe facial pain and you will have a tenderness on examination of all the sinuses. So, whenever you have a pain with a tenderness, you always put it on to an acute rhinosinusitis. The next thing is your subacute rhinosinusitis, that is between your acute and between your chronic rhinosinusitis. So, what are the symptoms? Which is lasting more than 4 weeks of duration and up to 8 weeks of duration. Whereas in a chronic rhinosinusitis, the symptoms will be more than 8 weeks and up to 12 weeks of duration. So, the basic difference between this is you will not have a tenderness in a chronic rhinosinusitis, whereas you will have a severe pain with a facial swelling sometimes and tenderness in a acute rhinosinusitis. So, as I have told you, these are the sinuses which are involved. So, this is your maxillary sinuses which are unilateral on both sides, and you have the multiple ethmoidal cells on both sides causing a sinus infection, may be acute or chronic. And then you have a frontal sinus on your forehead, and posteriorly you have your sphenoidal sinuses. So, the ethmoidal cells are the only cells which are multiple, whereas the frontal, maxillary and sphenoids are all unilateral or single. So, what is the commonest cause for a sinusitis? Most commonly it could be a viral etiology. Sometimes you have a associated bacterial infection. So, when do you get a bacterial infection? Whenever you have a cold exposure, whenever you have a recurrent upper respiratory infection which leads on, like for example, you can have a tonsillar infection ascending, or you can have an adenoids which is blocking the choana, causing a sinus infection and leading on to a sinusitis. And this sinusitis is very commonly seen in, particularly in swimmers, and normally it is happens or it is usually associated with the people in a contaminated water. And sometimes we do see severe sinusitis in people who have a profession of diving as a profession. And dental infection is very common cause for a sinusitis, because your teeth is related to your sinuses. So, you can have a root canal infection ascending on to the maxillary sinuses causing a sinus infection. The other causes can be a trauma which is untreated. For example, you have facial maxillary trauma which is untreated or neglected, can ascend into an infection of your maxillary sinuses or a frontal sinuses. So, what are the major symptoms which are must to require a diagnosis of a sinusitis? You should have a mucoprolonged nasal discharge, either it could be a unilateral or a bilateral. And whenever you have a nasal discharge, obviously you will have a nasal block and you will have a stuffiness of the nose. Facial pain, as I said, it's more severe in case of an acute sinusitis, but sometimes you have a dull or a kind of a vague facial pain whenever you have a frontal sinusitis or a maxillary sinusitis as well. And then when you have a severe mucopurulent or nasal discharge which blocks your nose and your paranasal sinuses openings, and you can have a decrease in your smell sensation as well. What are the minor symptoms? Obviously, you will have a headache whenever you have a sinus infection, particularly when you have a frontal or a sphenoidal sinusitis, you will have a headache. Fever, halitosis, fatigue is usually associated with an acute sinusitis, but sometimes when you have a subacute or when you have an acute on chronic sinusitis, you will have any of all these features like your headache, fever, bad breath, and obviously you will have a tiredness when you have all these things. Dental pain usually associated with the purulent discharge of your maxillary sinus. When your sinus is filled with pus, it can be also associated with the dental pain because your root of the teeth is in relation to your maxillary sinuses. And cough, whenever you have a postnasal drip, you can have a persistent cough which could be usually a productive cough because you have a persistent purulent discharge coming from your sinuses going down to your throat, from the nose going down to your postnasal area and going to your throat, and you can have a persistent upper respiratory infection, which is one of the causes for a persistent cough, probably a persistent postnasal drip. Okay, and the next one, you can have a ear pain. So why do you have a ear pain? Obviously, when you have a infection or a pus which is coming out of your osteometal complex and going posteriorly, it blocks your eustachian tube opening. Hope you know that your eustachian tube opens in the posterior part of your nasopharynx on your lateral wall. So whenever there is a trickle of your discharge from your osteometal complex, it trickles down to the posterior part via your choana, and then when it blocks your eustachian tube, you can have a ear fullness which indirectly causes a ear pain.